Hello everyone. I welcome you on for the revision session of Unit 4. This is regarding exceptional children and inclusive education. Let me share the screen. Okay. So this is Unit 4 revision. In this session, we will be talking about exceptional children and inclusive education. So exceptional children and inclusive education. First, we would be talking about what do we mean by exceptional children. According to Telford and Sorey, the term exceptional children refers to those children who deviates from the normal in physical, mental, emotional, or social characteristics to such a degree that they require special social and educational services to develop their maximum capacity. So, any children who differ from the normal children in terms of their social, mental, emotional, and physical characteristics, and when they have certain problems to reach their maximum capacities, then they are called as exceptional children. This is the definition given by Telford and Sorey. Children who are gifted have above average intelligence and especially above 130, and they show superior talent in some domain, whether it is art, music, mathematics, or anything else. Nature of exceptional children. The term exceptional children is applied to a trait of a person possessing up to the extent of deviation from normal. It is commonly applied to children who differ notably from the average children. An exceptional child deviates physically, mentally, emotionally, and socially from normal growth and development. Exceptional children cannot be benefited from regular classroom teaching programs. They require a modification of school practices and need special treatment in school to develop their maximum capacity. Exceptional children belong to both the extremes of physical, mental, social, emotional, and educational achievement. So, we have understood what does the nature of exceptional children involve, how they physically, mentally, socially, and emotionally, how they differ from normal children. ಸೊ ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳು ಅಂತಂದ್ರೆ ಯಾರು? ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳು ಇಲ್ಲಿ ನಾವು ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳು ಅಷ್ಟೇ ಅಲ್ದಿರಾ, ಅಂದ್ರೆ ಗಿಫ್ಟೆಡ್ ಚಿಲ್ಡ್ರನ್ ಅಷ್ಟೇ ಅಲ್ದಿರಾ, ನಾವು ಇಲ್ಲಿ ನ್ಯೂನತೆ ಉಳ್ಳಂತ ಮಕ್ಕಳ ಬಗ್ಗೆನೂ ಮಾತಾಡ್ತೀವಿ. ಹಾಗಾಗಿ ಇವರೆಲ್ಲರನ್ನೂ ಒಟ್ಟುಗೂಡಿಸಿ ನಾವು ಕರೆಯೋದಾದ್ರೆ ಇವ್ರನ್ನ ನಾವು ಅಸಾಮಾನ್ಯ ಮಕ್ಕಳು ಅಂತ ಕರಿಬಹುದು. ಅಸಾಮಾನ್ಯ ಮಕ್ಕಳು ಯಾರು? ಈ ಅಸಾಮಾನ್ಯ ಮಕ್ಕಳು ಅಂದ್ರೆ ದೈಹಿಕವಾಗಿ, ಮಾನಸಿಕವಾಗಿ, ಸಂವೇದನಾತ್ಮಕವಾಗಿ ಹಾಗೂ ಸಾಮಾಜಿಕವಾಗಿ ಸಾಮಾನ್ಯ ಮಕ್ಕಳಿಗೆ ಹೋಲಿಸಿದರೆ ಕೆಲವೊಂದು ನ್ಯೂನತೆಗಳುಳ್ಳಂತಹ ಮಕ್ಕಳನ್ನ ಅಥವಾ ಕೆಲವೊಂದು ಸಮಸ್ಯೆಗಳನ್ನ ಎದುರಿಸುವಂತ ಮಕ್ಕಳನ್ನ ನಾವು ಅಸಾಮಾನ್ಯ ಮಕ್ಕಳು ಅಂತ ಕರಿತೀವಿ. Gifted children. There is a group of students with special needs that is often overlooked by the schools, that is the gifted or talented children. So ಇವರನ್ನ ನಾವು ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳು ಅಂತ ಕರಿತೀವಿ. One of the most inclusive definitions of gifted children comes from the US Department of Education. Children and youth with outstanding talent perform or show the potential for performing at remarkably high levels of accomplishment when compared with others of their age, experience, or environment. These children and youth exhibit high capability in intellectual, creative, or artistic areas, possess an unusual leadership capacity, or excel in specific academic fields. So this is how the US Department of Education has defined the gifted children, wherein they have some specific ability, a special ability, wherein they are different from the others, they are more talented. Needs and problems. What are the needs and problems of gifted children? ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳ ಅಗತ್ಯತೆಗಳೇನು ಮತ್ತು ಅವರ ಸಮಸ್ಯೆಗಳೇನು ಅಂತ. Though many studies have found the gifted students to have lot of advantages in life, it would be incorrect to say that every gifted student is superior in adjustment and emotional health. In fact, gifted adolescents, especially girls, are more likely to be depressed and to report social and emotional problems. Many difficulties confront a gifted child, including boredom and frustration. in school, as well as isolation and ridicule from the peers. Schoolmates may be consumed with baseball or worrying about failing in math, while the gifted child is fascinated with Mozart, focused on social issue, or totally absorbed in computers, drama, or geology. Gifted children may be impatient with their friends, parents, and even teachers who do not share their interests or abilities. Because their language is well developed, they may be seen as show offs when they are simply expressing themselves. They are sensitive to expectations and feelings of others, so these students may be very vulnerable to criticisms and taunts. Because they are goal directed and focused, they may seem stubborn and uncooperative. So these are the problems which the gifted children undergo. Identification and education of gifted children. ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳನ್ನ ಗುರುತಿಸುವುದು ಹೇಗೆ ಅಂತ. Identifying gifted children is not always easy, and teaching them well may be even more challenging. Many parents provide early education experiences for their children. Even very advanced learning in the early grades does not guarantee that students will be still outstanding readers years later. Teachers are successful only about 10% to 50% of the time in picking out the gifted children in their classes. The following aspects could be considered in identifying a gifted child. Children who are gifted are precocious. They have their development is far more to their age compared to normal children. Children who are gifted learn in a qualitatively different way than children who are not gifted. So they pace up really high, and the way they understand things is completely mind blowing compared to normal children. Children who are gifted are driven to understand the domain in which they have high ability. So, gifted children doesn't mean they have high ability in all the areas. Rather, whichever domain they have very high abilities, there they are, extremely good. Children who are gifted excel in their information processing skills. So the way they process the information itself is so good that it makes them more confident and very different from normal children. Educating gifted children. ಪ್ರತಿಭಾನ್ವಿತ ಮಕ್ಕಳಿಗೆ ಶಿಕ್ಷಣವನ್ನು ನೀಡೋದು ಹೇಗೆ? Under challenged children who are gifted can become disruptive, skip classes, and lose interest in achieving. Sometimes these children just disappear into the woodwork, becoming passive and apathetic towards school. Teachers must challenge children who are gifted to reach high expectations, and certain programs can be used in order to educate the gifted children. What are they? You can have special classes for them, especially on Saturdays or summer holidays and things like that. You can have special classes. You can also have pull-out classes in the regular hours. Acceleration and enrichment in the regular classroom setting. So the classrooms also should be highly enriching. The curriculum should be taken care of. They should be given separate curriculum so that it will be more challenging for them. Mentor and apprenticeship programs. You can always have a mentor for these gifted children in normal schools also, and because of that they feel more happy and confident enough to learn in challenging situations. And you can also have community service programs. You can also involve such children in community service programs. Now, all this while we spoke about gifted children, now we will talk about the mentally challenged children, that is the mentally retarded children. The American Association on Mental Retardation tells or defines mental retardation as significantly sub-average general intellectual functioning accompanied by significant limitations in adaptive functioning in at least two of the following skill areas, that is communication, self-care, social skills, self-direction, academic skills, work, leisure, health, or safety. These limitations manifest themselves before 18 years of age. So before 18 years of age, if you have seen such characteristics and very low intelligence, especially below IQ of below 70, then if you have seen that child, if you have identified that child with these characteristics before the age of 18, then they can be considered as mentally challenged or mentally retarded. So ನಾವೀಗ ಬುದ್ಧಿಮಾಂದ್ಯ ಮಕ್ಕಳ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದೀವಿ. ನಾವು ಈಗ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದಂತ ಕೆಲವು ಕಂಡೀಷನ್ಸ್ ಇದ್ದು, ಅವ್ರು 18 ವರ್ಷದೊಳಗೆ ಈ ಕಂಡೀಷನ್ಸ್ ನಾವು ಏನಾದ್ರು ಗುರುತಿಸಿದ್ರೆ ಅಂತವ್ರನ್ನ ನಾವು ಬುದ್ಧಿಮಾಂದ್ಯರು ಅಂತ ಕರೀಬಹುದು. ಅವರ ಒಂದು ಬುದ್ಧಿಮತ್ತೆ 70ಕ್ಕಿಂತ ಕಮ್ಮಿ ಇರುತ್ತೆ, ಆವಾಗ ಮಾತ್ರ ನಾವು ಅವ್ರನ್ನ ಬುದ್ಧಿಮಾಂದ್ಯರು ಅಂತ ಕನ್ಸಿಡರ್ ಮಾಡ್ತೀವಿ. Okay, so as I told you, before 18 you can actually you can identify them, and if their IQ is below 70 and they have difficulty in adapting to everyday life, for an individual to be given a diagnosis of mental retardation, the low IQ and low adaptiveness should be evident in childhood and not following a long period of normal functioning that is interrupted by an accident or other type of assault on the brain. Genetic factors, brain damage, and environmental factors are the key determinants of mental retardation. The most distinctive feature of mental retardation is inadequate intellectual functioning. Mental retardation is classified as mild, moderate, severe, and profound. But if you have a student in your classroom who's mentally challenged, definitely that child's degree of retardation will be very mild. And such children with severe mental retardation are more likely to show signs of other neurological complications such as cerebral palsy, epilepsy, hearing impairment, visual impairment, or other metabolic defects that affect the central nervous system. Okay. Sorry. So most school systems still use the old classification of mild, moderate, severe, and profound. But now the American Association on Mental Retardation has developed a new classification based on the degree of support children require to function at their highest level. And those categories are intermittent, limited, extensive, and pervasive. So if it is intermittent supports are provided as needed. The individual may need episodic or short-term support during the lifespan transitions. Intermittent supports may be low or high intensity when provided. And what is this limited? Limited supports are intense and relatively consistent over time. They are time limited but not intermittent. They require fewer staff members and cost less than more intense supports. These supports likely will be needed for adaptation to the changes involved in the school to adult period. Then when we talk of extensive supports are characterized by regular involvement in at least some setting and not time limited. And when we talk about pervasive, supports are constant, very intense, and are provided across the settings. They may be of a life-sustaining nature. These supports typically involve more staff members and intrusiveness than the other support categories. So when we talk in terms of the remedial measures for these MR and planning education according to the level of mental retardation, remedial measures could be given. Preschool programs focus on school readiness and socialization activities. Regular programs for mild and moderate retardation provide individualized academic or other functional programs and interaction with non-disabled peers. Resource room programs are provided for remedial help to some students. Self-contained classroom program is provided to moderate and severely retarded children as a segregated classroom. The programs focus on age-appropriate and developmentally appropriate skills. The curriculum can be changed to meet the needs of these children and should be organized around the behaviors and information needed for adequate functioning. So ಹೀಗೆ ನಾವು ಬುದ್ಧಿಮಾಂದ್ಯ ಮಕ್ಕಳಿಗೆ ಶಿಕ್ಷಣವನ್ನು ನೀಡಬಹುದು ಅನ್ನೋದು. So what are the other things that we can do? Help children who are mentally retarded to practice making personal choices and to engage in self-determination when possible. Always keep in mind the child's level of mental functioning. The teachers have to individualize their instruction to meet the child's need. As with other children with a disability, the teacher has to make sure that they give concrete examples of the concepts. They have to make their instructions clear and simple. They have to give these children opportunities to practice what they have learned, have them repeat a step number of times and overlearn the concept to retain it. Have positive expectations for the child's learning, look for resource support and consider using applied behavior analysis for teachers. Now, let's talk about children with learning disabilities. Learning disability and difficulties, definition, nature, characteristics, and identification. So, when we say learning disability, a child with learning disability, it's a neurological condition which affects the brain's ability to send, receive, and process information. A child with a learning disability may have difficulties in reading, writing, speaking, listening, understanding mathematical concepts, and with general comprehension. And such group of disorders could be dyslexia, dyspraxia, dyscalculia, and dysgraphia. Each type of disorder may coexist with another. A child with a learning disability has difficulty in learning that involves understanding or using spoken or written language, and the difficulty can appear in listening, thinking, reading, writing, and spelling. ಸೊ ಕಲಿಕಾ ನ್ಯೂನತೆ ಉಳ್ಳಂತ ಮಕ್ಕಳಿಗೆ ಈ ರೀತಿಯಾದಂತಹ ಸಮಸ್ಯೆಗಳನ್ನ ನಾವು ನೋಡಬಹುದು. ಯಾವ ರೀತಿಯಾದಂತಹ ಗುಣಲಕ್ಷಣಗಳಿರುತ್ತೆ ಇಂಥ ಮಕ್ಕಳಿಗೆ, ಅವರ ಸ್ವರೂಪ ಹೇಗಿರುತ್ತೆ ಅಂದ್ರೆ, ಮೋಸ್ಟ್ ಲರ್ನಿಂಗ್ ಡಿಸಬಿಲಿಟೀಸ್ ಆರ್ ಲೈಫ್ ಲಾಂಗ್ and there will be high dropout rates, and children with learning disability who are taught in regular classrooms without extensive support rarely achieve the level of competence. Even children who are low achieving and do not have a disability, still, despite the problems they encounter, many children with learning disability grow up to lead normal lives and engage in productive work. Initial identification of a possible learning disability usually is made by the classroom teacher, that is the class teacher. If a learning disability is suspected, the teacher calls on a specialist. An interdisciplinary team of professionals is best suited to verify whether a student has a learning disability. Individual psychological evaluations and educational assessments are required. In addition, tests of visual motor skills, language, and memory may be used. So what are the type of difficulties they face? The first one is dyslexia. That is, it involves problem with reading, which affects approximately about 80% of the children with learning disability. Such children have difficulty with phonological skills, which involve being able to understand how sounds and letters match up to make words, and also have problems in comprehension. So they find it difficult in understanding things. Dyslexia is a category reserved for individuals with a severe impairment in their ability to read and spell. Dysgraphia is a learning ability that involves difficulty in handwriting. Children with dysgraphia may write very slowly, and their writing is very illegible, and they may make numerous spelling mistakes because their inability to match up with sounds and letters. And what is dyscalculia? Dyscalculia is known as developmental arithmetic disorder. It's a learning disability that involves difficulty in math computation. Okay, and when we talk in terms of their, they have poor performance in working memory, visual perception, and visual spatial abilities. A child may have both a reading and a math disability, and there are cognitive deficits that characterize both type of disabilities, such as poor working memory. And when we talk about dyspraxia, that means the child has some muscular problems, okay, problems related to the muscles, wherein it is very stiff. They find it difficult to walk around. Okay, few children who have learning disability may have dyspraxia also. So precise causes of learning disabilities are not known, but however, it is seen that few disabilities like dyslexia or dyscalculia is hereditary, and also few problems may have come up during prenatal development or delivery. Okay, some problem that has happened during delivery or during the prenatal development may bring in such problems. The researchers are also using brain imaging techniques like MRI, magnetic resonance imagery, to reveal any regions of the brain that might be involved in learning disabilities. So how do we teach these children with learning disabilities? Learning disability ಇರುವಂತಹ ಮಕ್ಕಳಿಗೆ ಹೇಗೆ ನಾವು ಪಾಠ ಮಾಡಬಹುದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಯೋಚನೆ ಮಾಡುತ್ತೆ. Many interventions have focused on improving child's reading ability. Intensive instruction over a period of time by a competent teacher can help many. We can take the needs of the child with learning disability into account during instructional time, provide accommodations for testing and assignments, make modifications, improve organizational and study skills, work with reading and writing skills, challenge children with a learning disability to become independent and reach their full potential. Okay, so when you help them with all these stuff, and when you start encouraging them to use their strengths instead of focusing on their disabilities, these children do a better job. When we talk in terms of other exceptional children, that is sensory, visually and hearing impaired, and physical impairment. What are these sensory disorders? Sensory disorders include both visual and hearing impairment. Visual impairment includes need for corrective lenses, low vision, and being educationally blind. And children who are hearing impaired can be born deaf or experience a loss in hearing as they develop. So first, let's take up visual impairment. A small portion of students have very serious visual problems and are classified as visually impaired. If you see on a Snellen chart, the regular normal eyes will have a reading of 20 by 20, but children who have problem with visual acuity, they'll have problem of 20 by 70 or 20 by 200 at sometimes on a Snellen scale. So they need corrective lenses, or they can use magnifying glasses when they are reading, or they may need big printed books in order to read, or sometimes you can always give them, any reading material that they could use their sense of hearing and touch in order to study. That is like the braille system. When we talk in terms of the hearing impairment also, it's very difficult to identify hearing impaired children. But if they are born deaf, we will know. But once they have come to the classes, and in the class, if they are trying to, tell when the teacher is telling them something, if they are just focusing on one ear, turning towards one side with their ear, or if they are asking the teacher to repeat something very frequently and they don't follow directions or frequently complain of ear aches, cold or allergies, then you should definitely send the child to a specialist, especially an audiologist, and get the child checked for hearing problem. So for children with hearing problem, you can have, they'll have two types of problems. That is, one is oral or manual. When you have oral approaches, it includes, especially when you have to teach them, when you have to give them special instructions, you can use either oral or manual approaches. While giving oral approaches, you can use lip reading, speech reading, that is, a reliance on visual cues to teach reading, and whatever hearing the student has. Manual approaches involve sign language and finger spelling. Sign language is a system of hand movements that symbolizes words, and finger spelling consists of spelling out each word by signing each letter of the word. So these things also can be used, and even technological advancements have given scope for hearing aids, telecommunication devices, cochlear implants, and all these help the children who do not hear properly in order to understand what they are learning better. When we come to physical disorders in children include orthopedic impairments such as cerebral palsy and seizure disorders. Many children with physical disorders require special education and related services such as transportation, physical therapy, school health services, and psychological services. So under physical disorders, you have orthopedic impairment. That is, orthopedic impairments involve restricted movement or lack of control over movement due to muscle, bone, or joint problems. The severity of problems ranges widely. Orthopedic impairments can be caused by prenatal or perinatal problems, or they can be due to disease or accident during the childhood years. With the help of adaptive devices and medical technology, many children with orthopedic impairments function well in the classroom. So for such children, if you help them in the classroom by giving them whatever minimum support they need medically, or if you give them adaptive devices, definitely they would be able to do well in the classrooms. Cerebral palsy is a disorder that involves a lack of muscular coordination, shaking, or unclear speech. The most common cause of cerebral palsy is lack of oxygen at birth. Special computers, especially, can help children with cerebral palsies to learn. And talking in terms of seizure disorders, the most common seizure disorder is epilepsy, a neurological disorder characterized by recurring sensory motor attacks or movement convulsions. Children who experience seizures are usually treated with one or more anticonvulsant medications, which often are effective in reducing the seizures but do not always eliminate them. When they are not having a seizure, students with epilepsy show normal behavior. If you have a child in your class who has a seizure disorder, become well acquainted with the procedures for monitoring and helping the child during a seizure. Moving on to attention deficit hyperactivity disorder. This ADHD is a disability in which children show consistently one or more of these characteristics over a period of time, that is inattention, hyperactivity, and impulsivity. So ADHD ಅಂದ್ರೆ ಅತಿ ಅವಧಾನ ಕೊರತೆ, ಅತಿ ಚಟುವಟಿಕೆ, ಮನೋಬೇನೆ ಅಂತ. ನಾವು ಹಿಂದೆ ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ದು ಫಿಸಿಕಲ್ ಡಿಸಾರ್ಡರ್ಸ್, ದೈಹಿಕ ನ್ಯೂನತೆಗಳು. ಅದರಲ್ಲಿ ಮೂಳೆಗೆ ಸಂಬಂಧಪಟ್ಟಂತ ನ್ಯೂನತೆಗಳಿರ್ಬೋದು, ಅಥವಾ ಸೆರೆಬ್ರಲ್ ಪಾಲ್ಸಿ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಸೀಜರ್ ಡಿಸಾರ್ಡರ್ಸ್ ಆಗಿರ್ಬೋದು. Okay, attention deficit hyperactivity disorder. In this, inattention, hyperactivity, and impulsivity are taken into consideration. And inattentive children have difficulty focusing on any one thing, and they may get bored with a task after few minutes. And even hyperactive children show high levels of physical activity, almost always seeming to be in motion. And impulsive children have difficulty curbing their reactions and don't do a good job of thinking before they act. And depending on the characteristics that children with ADHD display, they can be diagnosed as ADHD with predominantly inattention, ADHD with predominantly hyperactivity or impulsivity, ADHD with both inattention and hyperactivity or impulsivity. Okay, once how can we diagnose and what is the developmental status of these ADHD children? Usually ADHD is basically a classification in the psychiatric disorders of a specific diagnostic criteria. And in the preschool itself, you generally don't identify them, because unless and until they come to elementary school years, then they have to sit in one place and listen to the teacher. The increased academic and social demands of formal schooling often illuminate the problems of children with ADHD. Elementary school teachers typically report that such children have difficulty in working independently, completing seat work, and organizing work. They are restless, they are distracted, and the problems are more likely to be observed in repetitive or difficult tasks, or tasks the child perceives to be boring. What are the causes and treatments for it? Causes of ADHD is some amount of inheritance from the parents, or there's brain damage during prenatal or postnatal development. Even then ADHD could be a possibility. Among early possible contributors to ADHD is cigarette smoking and alcohol exposure during pregnancy or low birth weight. Because of this also ADHD could be a result. Strategies how to work with children with ADHD. You need to monitor whether the child's stimulant medication is working effectively. Then repeat and simplify instructions about in-class and homework assignments. Involve a special education resource teacher. State clear expectations and give the child immediate feedback. Use behavior management strategies, especially providing positive feedback for progress. Provide structure and teacher direction. In many instances, a structured learning environment benefits children with ADHD. And talking in terms of providing opportunities for students to get up and move around, break assignments into shorter segments, and also by following such strategies, you can help the children with ADHD. And also, when we talk in terms of these strategies, how ADHD children could be managed by taking help from others also. Okay, next we'll move on to autism spectrum disorders. Swalinate anta kariತೀವಿ ಇದನ್ನ. Autism spectrum disorders can, it can be differentiated in terms of its intensity, autistic disorder, which is a milder disorder, and Asperger's syndrome. Okay. Autistic is a severe disorder and Asperger's syndrome is a milder disorder. That's why it's called as a spectrum of disorders. And autism spectrum disorders are characterized by problems in social interaction, problems in verbal and nonverbal communication, and repetitive behaviors. Children with these disorders may also show atypical responses to sensory experiences. Autism spectrum disorders can often be detected in children as early as 1 or 3 years. And autistic disorder is a severe developmental autism spectrum disorder, and its onset can be anytime during the first 3 years of life. And it includes deficiencies in social relationships, abnormalities in communication, and restricted, repetitive, and stereotyped patterns of behavior. Boys are about 4 times more likely to have an autistic disorder than girls. So, when we are talking about Asperger's syndrome is a relatively mild autism spectrum disorder in which child has relatively good verbal language, milder nonverbal language problems, and restricted range of interests and relationships. Children with Asperger's syndrome often engage in obsessive, repetitive routines and preoccupations with a particular subject. And the causes for this autism spectrum disorder include brain dysfunction with abnormalities in brain structure and neurotransmitters. Genetic factors also likely play a role in the development of such disorders. Children with autism benefit from well structured classrooms, individualized instruction, and small group instruction. As with children who are mentally retarded, behavior modification techniques are sometimes effective in helping autistic children to learn. Next, we'll speak of speech and language disorders, emotional and behavioral disorders. So, in speech and language disorders, speech disorders, include articulation disorders, voice disorders, and fluency disorders. Language disorders involve, problems and difficulties in receiving information and expressing language. Articulation disorder is disorders in pronouncing. It is a disorder wherein the child has a problem in pronunciation, pronouncing the words correctly, and usually such children talk less in the class. They don't ask much questions because they feel embarrassed because of the pronunciation problem, and they're also worried about whether the other friends of them may be making fun of them. And because of that, they participate less in discussions, or when they're communicating with their peers also they find it difficult. Articulation problems can usually be improved or resolved with speech therapy, but it may take few months or few years also. Voice disorders are reflected in speech, which is harsh, hoarse, too loud, too high pitched, or too low pitched. Children with cleft palate often have a voice disorder that makes their speech difficult to understand. If a child speaks in a way that is consistently difficult to understand, then refer the child to a speech therapist. Fluency disorders often involve what is commonly called as stuttering. Stuttering occurs when child's speech has a spasmodic hesitation, prolongation, or repetition. The anxiety many children feel because they stutter often just makes their stuttering more worse. Speech therapy is recommended for children with stuttering also. Language disorders include significant impairment in child's receptive or expressive language. So, language disorders can result in significant learning problems. Treatment by a language therapist generally produces improvement in child with language disorder, but problem is generally not eradicated. It can be managed. Specific language impairment involves language development problems with no other obvious physical, sensory, or emotional difficulties. Sometimes this particular disorder is also called as developmental language disorder, and children with such problem have problems in understanding and using words in sentences. And also early identification of this problem could be done by 5 years of age itself. And intervention includes modeling correct utterances, rephrasing the child's incorrect utterances during conversation and reading instruction. Parents may also wish to send a child with speech related issues to a speech or language pathologist. So when we talk in terms of emotional and behavioral disorders, emotional disorders include disorders consisting of serious persistent problems that involve relationships, aggression, depression, fears associated with personal or school matters, and other inappropriate socio-emotional characteristics. So generally we call this as behavioral disturbances. Aggressive or out of control behaviors at times are seen. Some children classified as having serious emotional disturbance engage in disruptive, aggressive, dangerous behaviors, and they are removed from the classroom. And when they return to the regular classroom also, they need a special educator also along with the class teacher in order to help them to behave appropriately. Depression, anxiety, and fears. We have seen many children being depressed, but they'll just take their time and come out of that mood. But if persistently 2 weeks and above, if a child is being depressed, then naturally it's a call for us to take the child to a psychologist or a concerned specialist. So they become very lethargic and they believe that things are not getting really better. They feel I'm worthless, and when children show such signs 2 weeks or longer, you can you can identify that they are undergoing depression. They have poor appetite and they'll not be able to sleep. And anxiety in what when we talk about anxiety, it is being anxious or being worried about what is going to happen next. Anxiety involves a vague, highly unpleasant feeling of fear and apprehension. It is normal for children to be concerned or worried when they face life's challenges, but some children have such intense and prolonged anxiety that it substantially impairs their school performance. Some children also have personal or school related fears that interfere with their learning. If a child shows marked or substantial fears that persist, have the child see the school counselor. So when we say inclusive education, what is the concept of inclusive education and its importance and the merits and demerits of inclusive education? The concept of inclusive education, it came up in the World Conference on Special Needs, Access and Quality, and from that time onwards, the statement solicits government to give the highest priority to making education systems inclusive and adopt the principle of inclusive education as a matter of ಪಾಲಿಸಿ. ಸೊ ಅಂತರ್ಗತ ಶಿಕ್ಷಣ ಶುರುವಾಗಿದ್ದು ಈ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಟೈಮ್ ನಲ್ಲಿ ಎಲ್ಲಾ ರಾಷ್ಟ್ರಗಳು ಕೂಡ ಅಂತರ್ಗತ ಶಿಕ್ಷಣ ನೀತಿಯನ್ನ ಪಾಲಿಸಬೇಕು ಅಂತ ಹೇಳಿ ಆದೇಶವನ್ನ ಹೊರಡಿಸಿದ್ರು. Importance of inclusive education is because there have been efforts internationally to include children with disabilities in the educational mainstream. In order to achieve truly inclusive education, we need to think about and incorporate children with special needs into regular schools. As general education classrooms include more and more diverse students, teachers realize the value of accepting each student as unique. So what are the merits of inclusive education? Merits can be divided into 3 types. One, advantages for the children with problems, that is children with disabilities, advantages for the other normal children who are there with them, and advantages for the teachers. So first let's take up the advantages of inclusive education for children with disabilities. It improves the cognitive, motor, speech, social and emotional development of children through communication with the peers, functional mastery of skills and abilities, focus on the strengths and abilities of the child in the learning process, participation in public life and establishing friendly relations with other children. So how is it useful for other children? Formation of a tolerant attitude and natural perception of people with different characteristics, establishing and maintaining friendly relations with people who are different from them, social cooperation with people who are different from them, and formation of a non-standard approach and ingenuity to achieve a common result. And how is it helpful for the teachers? Better understanding of individual characteristics of students, mastering various pedagogical techniques for working effectively with children with disabilities, approaching children's perception for a better understanding of different situations, and formation of a holistic picture. Now let's talk about the demerits of inclusive education. Imperfect legislations in the field of education, which leads to lack of mechanisms for the development and financing of inclusive education. Insufficient material, technical support, and staff of secondary schools is another demerit of inclusive education. In other words, lack of special auxiliary educational equipment, lack of specially developed teaching methods and inclusive education programs, insufficient number of specially trained specialists to work with children with disabilities would be a hurdle. Inadequacy of infrastructure for children with special needs is another disadvantage. Insufficient psychological readiness of students and teachers to study with the children with disabilities is a major demerit. The problem of negative attitudes of parents about their normal, healthy children studying with children with disabilities, they believe that this delays the development of healthy children's learning. So, thus, it can be concluded that the implementation of inclusive education is very important. Proper training, sufficient funding, and awareness among people will eventually help children with special education needs to receive a quality education in regular schools in any country. So, this is regarding the revision session for Unit 4. Let me stop sharing. Yeah, with this, I end my session. Thank you.